All right, welcome everyone to Medicine with Ali's. Let's continue with iron profile. When you order iron profile, there are other conditions which can affect the iron profile other than the iron deficiency anemia. All right, let's start with iron deficiency anemia. In iron deficiency anemia, you have low serum iron, low ferritin, which is the storage form of iron, and high TIBC and low transferrin saturation. What's the TIBC? TIBC is the ability of the body to get iron. Whenever the body thinks and it needs iron, the TIBC is going to be high. Whenever the ferritin is low, the TIBC is going to be high because the ferritin is the storage form. So when the ferritin is low, the body thinks it needs iron, so the TIBC is going to be high. Transferrin saturation is the serum iron divided by the TIBC. Okay, so it's going to be definitely low in iron deficiency anemia, below 18% or below 20%. And some people say, if it's below 15%, it's most likely iron deficiency and anemia. Okay. In anemia of chronic disease, you have low serum iron. Why is that? Because in anemia of chronic disease like SLE, chronic infection, malignancy, what happens? There is almost always low-grade inflammation or signal to the liver that it tells the liver, please release hepcidin. Hepcidin is released from the liver. Hepcidin will go into two places. One is the GI tract, two is the macrophages. When the hepcidin goes into the GI tract, it prevents the GI absorption of iron. And when it goes into the macrophages, what will happen? It will prevent the iron release from the macrophages into the serum. So the end result is low serum iron. Now, the ferritin is going to be high. Why is that? Because it's anemia of chronic disease, guys. Think of it like SLE. And SLE is a chronic inflammatory condition. So ferritin is an acute phase reactant, so it's going to be high. طبعا in real life, it's not necessarily to find ferritin high in anemia of chronic disease. However, in your exams, it's going to be high. It could be normal, as simple as this. Now, the TIBC is going to be low because the ferritin is high and transferrin saturation is going to be low. Now, sideroblastic anemia. In sideroblastic anemia, the serum iron is going to be high, ferritin is going to be high, TIBC is going to be normal or low. Hemochromatosis. In hemochromatosis, you will get high serum ferritin, high serum iron, low TIBC, and high transferrin saturation. Now, in pregnancy and OCB like oral contraceptive pills, you're going to have low transferrin saturation. So differential diagnosis for low transferrin saturation is on top of the differential is iron deficiency anemia, then anemia of chronic disease, then pregnancy or oral contraceptive pills. Now, this table is from Pocket of Medicine, and there's a mistake here, or I would say it's not correct. Okay, in anemia of chronic disease, they are writing here, the TIBC is going to be high, and this is not true. In anemia of chronic disease, the TIBC is going to be low because the ferritin is high. And here, what we have, this is the reference, chronic anemia stat pairs. You can just Google it, write chronic anemia stat pairs. You will find, TIBC is going to be low in anemia of chronic disease. It's not high, the TIBC. Could be normal, but it's not high in anemia of chronic disease, okay? And it's usually low. In your exams, it's low. All right, now this picture or table is from NEJM, New England Journal of Medicine. I like this table because this differentiates between anemia of chronic disease and iron deficiency anemia. How do you differentiate? By soluble transferrin receptor or transferrin. And soluble transferrin receptor or transferrin, both will be either normal or reduced in anemia of chronic disease. However, they are going to be high in iron deficiency anemia. So in iron deficiency anemia, transferrin is going to be high. Soluble transferrin receptor is going to be high as well. However, in anemia of chronic disease, it's normal. Okay. Ferritin is, of course, one way to differentiate. Ferritin is going to be low in iron deficiency anemia. However, it's going to be normal or high in anemia of chronic disease.